I'm Gini Milkey, and I am the soon-to-be retired state representative from Brattleboro District 1. I've served on the House Healthcare Committee for the past 6 years and in the legislature for 20 years. It has been quite exciting working on healthcare in the past 6 years because of the opportunities that we've seen to move towards a real system of healthcare in Vermont. Looking forward to the new session starting in January and these design options that are going to be presented by Dr. Shao, I am hopeful that what he will come up with is something that is single payer or close to single payer, or a way to gain the advantages of single payer within whatever restrictions we may face from the federal government in terms of the recent legislation that was passed on that level for healthcare reform. Many countries have single-payer systems, some have systems that could be called multi-payer systems, but that in some cases have all of the insurers using the same forms, using the same rules and regulations, doing the same thing, so that in effect the people delivering healthcare to us have a simplified system, and I think that is a key to what we need. Primary care physicians have testified in the last 6 years to our committee that the complexity of what they face with the low reimbursement rates and being nickeled and dimed by insurance companies have created an environment that is very, very difficult for them to work under. They end up spending all day pulling faxes off, telling them that formularies have changed, trying to figure out what to give for prescriptions to their patients so that they can get them reimbursed. Credentialing has varied. We've done some things in Vermont that have standardized some of those things, but the simplicity that comes with a single-payer system, or with something that acts like a single-payer system and involves more than one payer, that, I think, is the way I hope we are going to go in 2011. We may, as I mentioned, have restrictions from the federal government, but I think that Dr. Shao, who designed Taiwan's healthcare system and many other things, he's a system designer, I think that he will be able to figure out how we can work within whatever federal restrictions we have and still get as close to what we want in the state. So that's what I hope we see, and time will tell, and I'm anxious. I won't be a part of it this year, but I'm still just as interested in it.